Thanks, Dave. Well, it's an issue that many women deal with, and they may not even know that there's treatment for it. Here to explain more about a problem that is more common than you may think is Dr. Edmund Rhett of Rhett Women's Center. How are you, Dr. Rhett?
I'm fine. How are you?
Wonderful to have you back. And I mean, last time
me.
we talked about some issues that women might have. Today, talking about a big issue, and like you said, a lot of women out there might be suffering from it, have no idea, and they've been suffering for years.
Women who has periods that interfere with their lifestyle, where they can't go to work or school, they can't go out to normal activities, play, go to the beach, go out in the boat. Those periods are problem periods, and we have many things that we can do to help them.
And the thing is, we're not just talking about a certain age group. I mean, this could be a lot of different women from a large range, I guess you could say.
Well, we have temporary things for women who want to have children in the future, and then we have some permanent solutions for women who finish childbearing.
Okay, well, let's first talk about some of the temporary solutions that we might be able to utilize if we come over to your center.
And every woman's different. Some can tolerate a pill. Some can take the pill continuously and never have a period for a while. You could use the patch. You can use implants, specifically something called Implanon. We have a progesterone IUD that we can use. So all of those things can really control periods, and every woman's different, like I said at first, and so you have to sort of go through with each person what's wrong with them and how you're going to fix their problem.
Right. Dr. Rhett, you've been doing this for years. Why do you think it is that women just deal with it like it's just something that should be everyday occurrence?
They think that their period is just like everybody else's, and that somebody who doesn't have any problems at all with a period thinks that somebody who has terrible periods is just a wimp. I mean, that's the way they sort of look at them, and and the person who's having the horrible periods kind of feels like a wimp and doesn't know what to do.
And don't say anything.
And the gynecologist that they see can help them.
All right, so I think we have video right now that we want to show
This
some
is
of our
of a
viewers.
permanent solution of something called NovaSure, where we take a radio frequency and put it up into the uterus. In under 2 minutes, we ablate the inside lining of the uterus, and about 70% of the time, these women will have no period. And about 95% of the time, these women will have very normal, very light periods.
Is this painful, Dr. Rhett, or how is this local anesthesia?
In our center, we're accredited, so we can do it with an anesthesiologist.
Okay, wonderful.
And some places do it with basically a lot of analgesia, a whole lot of medicine. But when we do it with an anesthesiologist, the procedure's over, the patient's awake, they go home. There's a little bit of cramping usually afterwards. Every now and then somebody will have severe pain, but most women are back at normal activities the next day. Now, this procedure is intended to replace hysterectomy for abnormal uterine bleeding.
And this is permanent. Let's make sure that we, right.
You have to understand, when we destroy the inside line of the uterus, that if you got pregnant, it would be very dangerous both for the patient as well as the unborn baby. So
after you get a procedure done like this that's permanent, I guess you would want to continue to see that woman for maybe every 6 months, or how would you work?
I wouldn't do the procedure unless a woman had a permanent form of contraception. Either she's had a tubal ligation or her husband's had a vasectomy, and because it is intended to replace hysterectomy. Hysterectomy is a fairly complicated procedure.
Very much so.
We do a lot, but if we can replace it with something that somebody's back at work the next day or back at normal activities the next day, it's sort of a godsend for those patients.
I got you. Well, Dr. Rhett, let us know exactly where you're located at, where we can find you.
We're over on Long Point Road, and we can be reached either through the web at Rhett Women's Center or at 375-2210.
Love it. Well, thank you so much, Dr. Rhett, for being here. Always a pleasure to see you.
So nice to see you,
And if
Laura.
anybody
Thank
needs you, all they need to do is just give you a call and make an appointment.
Thanks a lot.
Thanks so much.
Okay.
All right, we're headed out to the ballpark with Bill Murray, Darius Rucker, and our very own Dave Williams, knocking it out of the park. You don't want to miss this great event for an amazing cause. Stay with us.